7:12 now at Newstalk 96.5 KPEL. It is a big month, and a month that a ton of people are focused on colon cancer, colorectal issues, and cancer screening. Dr. Melanie Bienvenu is here from Lafayette General. Good morning. Thanks so much for coming in and getting up early with us.
Good
we
morning.
appreciate it.
Not a problem.
So, you start to hear these stories, and one of the people, I just happened to be watching an interview on Friday with Katie Couric, the former anchor of the Today Show, whose husband died pretty suddenly back in the 90s, and she has kind of made it her mission to talk about screening and awareness about colon cancer. And I know it's one of those things it's hard to talk about, and I think a lot of people would just rather not even think about that part of their body, much less think about cancer and looking at it that way. But tell us a little bit about your experience and in treating this and screening for it, and how just a screening could really catch things early on.
Yeah, so I'm a gastroenterologist, and so this is part of what we, one of the main things that we do as GI doctors. And it's important to know that, people kind of don't want to think about it, but it is the second leading cause of cancer in the United States is colon cancer, and it does not discriminate between genders. So male and females are equally as susceptible to this disease. But, in terms of screening, there are different ways to screen for colon cancer. And, the one we talk about screening tests as either ones that detect or can detect things or ones that can prevent colon cancer. And in terms of detection, I mean, there's certainly stool tests that we talk about that look for either microscopic amounts of blood in the stool versus DNA testing. And those tests are out there, and they're certainly better than not doing anything at all. But when we talk about preventing colon cancer, we really talk about colonoscopies. So as colorectal cancer is one of those cancers that you can actually prevent, which is not something you can say about other type of cancers.
Because a lot of them, sometimes once you find out, we were talking a few minutes ago about pancreatic cancer, sometimes the diagnosis is when you find out you have it, and then a lot of times the prognosis is 6 months. I mean, it's sad, but we do have these screenings out there. Now, I know there's a lot of myth out there about a colonoscopy, and people who are just like, nope, I'm not doing that. I know the process. Not no, but hell no. I think the situation has probably changed if you have a patient that you end up finding something.
Yeah.
The nerves about it on the front end, then based on the back end, someone says, okay, wow, I can prevent it. I can see these sorts of things.
Yeah, absolutely. I mean, I certainly have lots of patients who, when they haven't had them done, they're saying, well, I've never really had any problems, so I never got one done. Well, I mean, colon cancer is one of those cancers that you may have zero symptoms and actually have developed the disease. But, in terms of colonoscopies, it's not something that people look forward to, certainly. But nowadays, we've certainly streamlined it into it's really not that much of an unpleasant experience. I try to tell patients that probably the worst part about it is doing the preparation for it.
Yes, that's what I've heard.
But beyond that, it's, we use our anesthesia doctors now to put people to sleep for the procedure. It's very comfortable. We have lots of different techniques that reduce any type of discomfort after the procedure itself. And so, for the most part, if you can get through that bowel preparation, it's really not that big of a deal.
It makes for a bad couple days, but then you're ready.
Yes, exactly. And
just water and lemonade for 2 days, something like that, right?
Well, usually just the day before.
The day before.
Yeah, we talk about clear liquids usually just the day before. So some fasting there, the preparation the night before, and then the actual procedure the day of. And people can go back to work the following day. So it's really that one day of the procedure that you're down for.
And really, that's probably mainly because of the anesthesia, right?
Yes.
I mean, that's the big deal. Okay.
Yes, exactly.
So let's talk about the patient who needs to do this. Is it an age thing? Is it a family history thing, or a little bit of all of it?
Yeah, so the biggest risk factor is age. Our gastroenterology guidelines recommend screening for what we call average risk individuals starting at age 50. That means no family history of colon cancer or colon adenoma polyps, or the type of polyps that can turn into cancer. Actually, the American Cancer Society last year came out with an updated guideline. They recommend actually age 45 for patients as well. African Americans are at higher risk, so they should be screened earlier, usually at age 45. And so, it's definitely out there. The unfortunate thing is that we do find it in young individuals, even less than 45 years old, and certainly have had my encounters with that. And the sad thing about that is that usually these young individuals are very advanced at the time we catch them, because they think they're young and they're healthy otherwise, and they kind of ignore the symptoms.
In those younger cases, I know you mentioned you might end up with a diagnosis with no symptoms. In those younger people, though, have they usually been ignoring some symptoms?
Yeah, so those individuals usually will, by the time they present to us, are having some abdominal pain symptoms or some change in their stool, and they just thought it was regular constipation, which is certainly out there in young individuals, and so, unfortunately, they get detected a little bit later.
So just on an average, what is a prognosis? Say you go today, you have a colonoscopy, you get the results in a few days, and yes, it is colon cancer. How is it treated, and what is the prognosis usually?
Yeah, so it sort of depends on how quickly you can or how early you detect it. There certainly are some individuals out there that, surgery sometimes is all they need. They go to surgery, they remove the tumor. Every time when a surgeon does this, they remove what we call lymph nodes, and depending on that finding, depends on if they actually need anything afterwards in terms of chemotherapy. But oftentimes chemotherapy may be indicated for some patients, and we have really good ways to treat colon cancer nowadays. So if you certainly catch it early enough, the prognosis can be very good for people. So
I love to tell people about the medical professionals that we have here. I know there is a contingent of people who think, oh my gosh, if I get a diagnosis like this, I have to go somewhere. Like, I don't know if I want that diagnosis, if I have to go to New Orleans or have to go to Houston. Lafayette General has a huge cancer treatment facility, in what they do. And obviously the screening side, which is where you are as a gastroenterologist, the resources are here.
Absolutely. Yeah, we have wonderful doctors here, surgeons, oncologists, gastroenterologists, within the community that are certainly more than capable and very familiar with this disease. So
finally, I want to ask, how do people go about, if they are of the age and they are experiencing some symptoms, is this something they have to go through their primary care doctor and get a referral for, or do you contact a gastroenterologist directly?
It sometimes depends on insurance, but for the most part, you can contact gastroenterologists, directly nowadays and schedule colonoscopies. So,
Dr. Melanie Bienvenu, thanks so much for coming in.
You're
I hope
welcome.
we have kind of demystified a little bit. I think any type of cancer screening, of course, human nature is like, I don't know, let me put the blinders on, and but the blinders don't work when you actually have cancer,
yes,
especially if it could have been caught early.
Yes,
Thanks for coming in.
You're welcome.
Good to see you.
Thank you.